good morning. I'm sorry that I missed Cassandra's presentation. I was doing some last minute stuff this morning. So what we'll be talking about today is family connections. And what I'll be doing is giving you all a history of how CYFD Protective Services adopted this evidence-based practice model. So there's going to be a few slides about going back in our journey and how we came to this point. So just to introduce myself, I'm Marianne Hernandez-Jimenez. I'm one of the county office managers here at CYFD Protective Services in Dona, and I oversee all the investigation units, 4 investigation supervisors. I oversee in-home services, which is really what we'll be talking about today, as well as the supervisor. So I love what I do. I've been with the department a little over 23 years. Close to retirement. I'm kind of happy about that too, but I don't know what the heck I'm going to do without the crisis and, just the craziness that happens in our world. I've done a lot of things at CYFD, and I really think that's helped me to stay there. I have trained new employees. I have helped adopt new initiatives. We're right in the midst of safety organized practice, and you guys can Google that. It's really one of the best practice ways in child welfare. So it's taking a critical look at how we work with our families and how we can best support our families. We also have a new structured decision-making tool, which has really changed up the way, get that. It's really, I guess. Oh, okay, all right. So our new structured decision-making tool has really changed the way that we assess safety. And so that has been implemented a little over 3 years now. Other things that I've done, I participated in a 9-month infant mental health group that was targeted for child welfare. Supervisors and managers love that. I might consider doing that once I retire. Let me see. Oh, I've also been an adjunct instructor here at LMSW, and I've taught the basic child welfare course. So I've done a lot, and again, I really love it. I feel like this is my passion. I also really feel that my practicum year when I was a master's student should count. It was very intense, very fun, and that's really what grabbed me to child welfare. In the spirit of full disclosure, this is the first training I've done in person in almost 2 years. If I'd be at home, I'd be wearing shorts and, have a nice shirt on, but, so, I'm glad that I got dressed, right, that I remembered that we're training in person. All right, so, like I had mentioned, or what I will tell you, is that CYFD, we're a huge agency. We do a lot of things. What comes to mind when you all think of CYFD Protective Services? You can tell me whatever comes to mind. What do? We what? So many things. We do so many things.
Take kids.
We take kids, right? We remove kids from their families. Yeah, that's what I thought, when I was first training to be a social worker.
See, I would say you place children in a safe place for healing while the family can work.
Right.
That's my perspective of the family.
Okay. So Betsy said we place children in a safe place to heal while the parents do some work, right? Did I summarize that good? Okay. All right. So yes, we do investigations. So we are the entity, per state law, per our children's code, we are responsible for going out once a report is screened in to assess the immediate safety of a child. So how many are educators here? Okay. How about counselors, therapists? All right. Who am I missing? Mayor Social worker. Social worker, yeah. Social workers? All right.
Foster parents?
Foster parents. We're now calling our foster parents resource parents. You guys will see the change in that language. Yeah. So we do a lot of things at CYFD. What I'll be focusing on today is really a small population of our CYFD employees, and it's our in-home services unit. Now, in-home services, that's where I first started. And that is, I would say, my baby. I was a practitioner for, 8 years, and then a supervisor for another 10 years? 12 years. And so in-home services, I love in-home services. What we do in in-home services is we try to prevent removal of children by providing reasonable efforts to keep the children in the home. So we work with families where the children are at high risk of maltreatment. That means that these children are at high risk of being abused or neglected again. We don't have enough to remove the children. Also, another important part of our team is our children's court attorneys. They represent us, and we have to staff every case with them whenever we are looking at removing children. So it's not just the supervisor's, the worker's decision, the supervisor's decision, even my decision. I always want to go back and staff with our attorneys. They tell us legally if we have sufficient evidence to remove a child. So before we ever get to that, what we want to do is provide quality services, which is family connections. So I'll be talking a little bit about this, and I know I'm a little short on time, so I'll try to just kind of give the high-level overview. But what I'll be talking about is why here in New Mexico did we need an evidence-based model for in-home services? How did we get here? So I'll talk about the journey. I'll provide an overview of family connections, also requirements that are needed to implement family connections, and as well as our CYFD and contract provider implementation plan. So every one of you in this room, if you work with an agency and if you have a concern about a child or you feel that there's some needs, you can make a referral, so which is awesome. All right, so I'll get to that in a little bit. So our journey started in 2019. And as part of the Children's Bureau, which is a federal agency, the capacity building for states, we invited them to assess our in-home services program. So what the ask was that we develop and recommend practice improvements to our infrastructure. We wanted to do a better job to improve outcomes. And I think I can probably say this with a fair amount of certainty, because I did in-home services for a long time. Sometimes we didn't know if we were doing a good job with our families. Sometimes we didn't know, did they achieve their goals? Did we do what we needed to do to help these children? So honestly, we were all over the place. So the same type of service or in-home services that you would receive in Dona County could look very different in Farmington. So we were one of the only programs within CYFD that did not have an evidence-based practice model. And actually, all of our internal CYFD in-home services practitioners are master level clinicians. So we really wanted to utilize their degree and their expertise and their clinical skills to the greatest potential. So the goal, way back when in 2019, is that we wanted to adopt an IHS model that supports safely keeping children in their own home. Now, I should have said this at the very beginning. We all have biases. We all, come to this room with beliefs, values, things, our own experiences that contributes to our lens, right, and our perception of children that are being abused or neglected. Some of us may feel that children should be removed. If they're hit, slapped on the face, punched, they should be removed from their home. Some of us may feel, what's going on with that parent? What's happening in that home? What can I do to help? Okay? So I just wanted to set the stage for that, and that's perfectly okay. We all have them. I have them. We all have them. We also wanted to statewide provide an accurate assessment of quality services. And we also, I'm just really pleased. Cassandra was one of my bosses, way back when. And I think we really have done a good job since, I wish we would have done it then, of getting evidence-based, reliable, valid practices. Safety organized practice is one of those. You all can look at that. You can just Google it. And also our structured decision-making tool. Evident Change was the agency that helped us to implement these tools. And something I forgot to do, and I hope everyone can see it. I'm going to pass this around and you guys can take a look at it. This is the intervention manual that every in-home services practitioner, as well as our contract providers that they use when they're working with a family. We've never had an intervention manual before. We've had policies and procedures, but we never had a structured way to deliver our services. So I'll pass that around. Okay. So just real quickly, we did a problem exploration and a root cause analysis. So we listened to our in-home practitioners, investigation supervisors, family members. I did a listening session, it's been about a year now, with 5 or 6 family members, and it was hard to hear some of the things that they said, but it was very true. They felt that they weren't supported, they felt that they were told what they needed to do, they felt that they had to comply with what we were asking them to do. So back when Secretary Blaylock was still with us, we met with him. Another big part of our work in New Mexico is working with tribes. We have the Indian Child Welfare Act that we have to comply with. That's a federal law. So we met a lot with our tribes, pueblos, and nations to get their input. We also were gathering data. We had a lot of quantitative data. We had a lot of qualitative data, not a lot of quantitative data. So, all right, so this is every state in the United States has to participate in a child and family services review. That is basically, in layman's terms, that's a federal review, and we have to be in compliance with what the feds are asking of us. So there's 18 items in our federal review tool. Number 2 is a big item, number 2 and 3 for in-home services. And it's services to protect children in the home and prevent removal or re-entry into care. So contrary maybe to popular belief, we cannot just go and grab a child and say this child was hit or hurt, we're taking them. We have to provide reasonable efforts, if it's appropriate, to keep that child in the home and provide some services. And then risk and safety assessment and management. So when my IHS practitioners are going out into the home, how are they assessing safety? How are they observing the family? What kind of questions are they asking? Are they meeting with the children alone? So as you can see there, round 3 is from 2015 to 2018. And that's, here in New Mexico, we have the larger counties that are part of our federal review sites. Dona will always be one, because we're big. Bernalillo will always be one. And then Santa Fe, and there's a few others. So you can see there that we don't do too well. We did not do well in our federal review overall. And so our CFSR review in 2018 and 19, that was all sites that our quality assurance team reviewed. And then again in 2019 and 20. So just giving you all some stats. And there's also another very important item to in-home services, which is item 12. And there's 3 parts to item 12, but because in in-home services we don't work with our resource parents, that's not applicable. So item 12A is how do we assess the needs of our children? And did we provide the appropriate services? So an example would be if a child maybe needed like an after-school program. Did we say, hey parents, get this child into an after-school program, or did we really help them? Did we say, hey, let's go down to the school together, let's fill out the application? So they look at our efforts, our concerted efforts. So also, 12B is the needs and services to parents. So if a parent has a substance use issue, did we give them a piece of paper and say, hey, go to this agency? Or did we talk to them about it? Did we educate them about it? Did we offer transportation? So what did we do that was concerted? And here we did a little bit better, but we always want to be higher. I thought this was important, and I just think it's interesting. So we have what's called short stayers in New Mexico. And the way that that's defined is a child who enters foster care and remains in foster care for less than 8 days. We're not doing good in that area. Why do you guys think? What would be a reason why we would take a child and then return the child home in 8 days? What impact might that have on that child?
Lack of foster care parents.
I'm sorry?
Lack of foster care.
Yes, yes. It's tough. It's tough. Our resource parents, yeah. They're tired. They're maxed out. Yeah. Yeah. Thank you. Another issue is the trauma. Whenever, and sometimes it may be the best decision at that time, but the long-term residual effect is trauma that's caused to that child. That's another layer of trauma. Are you guys familiar with ACEs? Okay, yeah. That's a perfect example of that. So these short stayers that between 2014 and 2020 represented almost half of our kids that entered care, and then we returned them back home. So why do that, right? So we felt if our community partners better understand the value and target of in-home services, then we may be able to decrease short stays. Here in New Mexico, and I know that they're proposing a bill to change it, we don't go and take custody of children. Law enforcement gives us custody, hands over custody to us. Unless we write what's called an ex parte custody order, then that is signed by the judge. But if we can reduce this by even half, we would be reducing the trauma that we cause to these children and to the family. Because why would we take them in the first place if we were going to give them back a couple days later, right? Yes.
I have a question about short stayers. Is that included all of our kids that we get and then grandma comes and gets them? That includes those, right? That go to a family member? But I
yes.
think they changed sort of that process too, but that includes all of those guys too.
Yes.
Which is the most what I see.
Yeah, yeah.
Moving to a family member, not right back into their home.
We have to have permission from the parent to do that. So that's a good question that Betsy asked. So whenever we do take custody of a child or are given custody by law enforcement, we have 2 business days. So Saturdays and Sundays don't count. So if we pick up a child 12 o'clock in the morning on Saturday morning, we have to make a decision by Tuesday at 5. But Betsy's question was, where can we return the child to a relative? We can only do that with the permission of the parent. If we don't have a parent to work with, sometimes our parents disappear, then those children need to remain in custody. Okay. All right. We also had some gaps in our data. And we are really, which is something that I'm really proud of, but I was also very scared about, is we are a data-driven agency. Data initially scared me, but data tells a story, right? There's a story behind the data. So I'll just go over one. One of the data gaps is the types of services that we provided to families. So what kind of services were we providing and how is that documented? Also reasons for case closure. We may have, I'll use the example again in Farmington. Let's say they closed out the case because the parents met the goals that were the case plan goals. But let's say we worked with them down here, we may not have felt the same. So we were really all over the place when it came to how we were capturing data and evaluating data. So the data led us really to come up, for us to all work together and come up with an evidence-based model. So we needed this model to address our current lack of consistent practice. And we felt that an evidence-based package brings quality assessments, brings a practice model that's been tried and true, training, supervisory supports, fidelity measures, and implementation supports. I won't read the rest of those ones. This one is really the critical one there. Okay. So all of these changes, all the work that we did for 2 years led us to come up with criteria to pick an evidence-based model. And there's lots of them out there. There's multi-systemic therapy. There is safe care. There is there's the home builders model. So what we did is we came up with questions. And there was a team of us from all of New Mexico. Back then we met in person. It was awesome because we met in Albuquerque. I'm sorry if you guys can't see that. I'll just go over some of the highlights. So what was important and unique to New Mexico? Our culture, our native tribes, So all of that are rural and metro, right? We have a lot of rural areas here in New Mexico. So we needed an evidence-based model that was going to be a good fit with all of these things here. You guys see that? A little sketchy, sorry. I think we're gonna get them sent out to you as well. We also needed it to be a good fit with CYFD for a lot of the reasons that I spoke about. So what this is our strategic plan that the Office of the Secretary, our executive leadership came up with. So what was important to CYFD Protective Services? I'll just talk about a couple of them. Increasing community-based mental health services. Any of you all a part of LC3 here in the community? Yes, yeah, I'm part of that. Our goal is to, really help increase the availability of our community-based mental health services. That's one of the goals. We wanted to do better at data. We also need funding, right? We're always needing funding. Unfortunately, in protective services, we have high vacancy rates. The work is hard. And also increase training and support. There's a saying, what is it called? Spray and pray. You give everybody a training and all right, now go out and do it. Do it to fidelity. Do it to, the way that you were trained. That's not the way we learn as adults. So it needed to be a good fit. Other criteria that was important to the model of family connections, because it's an evidence-based model, the replication of family connections, I'll show that in a minute, has really helped to reduce maltreatment of children. So any supervisor who supervises family connections has to be a master level. We also have our contract providers. Our FYI is our sister agency, or a very close agency to us, here in Dona. Anyone outside of Dona here? Okay, so I'll talk about the counties that it was implemented in. And also equipment, which is really cool. I'll talk about that. We need to have laptops to go out in the field. And I'll tell you, before the pandemic, very few of us at CYFD had laptops. We were working in the Stone Age. It's crazy. We had our, what do you call those, desktops? Yeah. Crazy. Yes. So we also, because Family Connections is not only implemented within CYFD, it's also implemented with our contract agencies. So our contract agencies needed to have all of this criteria as well. All right. So we came out with where we were going to be rolling out Family Connections. And so these are the CYFD county offices, and these are community-based agencies. You can see FYI here in Dona is our agency here. All right. So now I'm going to talk about Family Connections. Any questions so far about the history, how we got here? Yeah. Okay. So Family Connections. It's an evidence-based approach to engaging families in change-focused work during service delivery. So what is FC? It's a multifaceted program with standardized components. In order for a program to be an evidence-based practice, the components need to be standardized. So if Farmington's doing Family Connections, working with a family in week 4, it needs to be the same way here in week 4 in Dona. Okay, let me see if there's anything else here. What I'd like to talk about is all of the different theories that Family Connections, the underlying theories of Family Connections. And there's a lot. When our practitioners and our contract providers got trained, they went through 12 hours of e-learning modules. So in those 12 hours, they learned about these theories. They learned about what they were. Most of our workers internally, I can't speak for our contract providers, are social workers. And so having graduated from LMSW or Highlands or Western, like we should know these theories inside and out, right? And you social workers here in the room probably know these too. So all of these theories form the basis of family connections. This is the way we approach and work with our families. Another big component of FC is valuing the culture of the family. That is just so important, especially here. I'm always advocating up north because there's not a lot, but our families from Mexico are undocumented citizens. Like that's a unique culture, right? They have unique needs. Their day-to-day customs and traditions and practices, they look different, right? So it's really important. This is really a cornerstone of family connections. That every family connections program specialist, that they have to put this into practice in every family connections case. They're required to understand each family's race and ethnic background and how it's impacted their lives. They're required to understand and learn about and be curious about their trauma and how that has impacted their life. They really should seek to understand throughout the whole life of the intervention how their family's cultural background is unique and really seek to learn about it. I'll talk about this in a minute because I think it's on a future slide. Okay, so this is interesting, is the history and research of family connections. So yeah, does it really work? So this is what the research has found, and if you guys, in the PowerPoint, I'll make sure to put the resources inside those. But this is what the research found. So family connections has been implemented in New York City, in all the boroughs. Did I say that right? Boroughs in New York City. It's been implemented in Texas. Most recently in Arizona, which is really cool because they're kind of in the same stage of implementation that we are here in New Mexico. So we've communicated with them often. But this is what we want to see, and this is what we weren't sure of with our in-home services model. We want to see a reduction in risk factors, such as caregiver depressive symptoms, parenting stress, and life stress. We know that when a parent is better able to handle their stress, or they're able to reduce their stress, that it's likely that it's going to reduce their child getting hurt or neglected. Another one is an increase in protective factors, such as parenting attitudes, parenting satisfaction, family functioning, and social support. So parenting attitudes, that's how they feel about their child. You know, do they take delight in their child? Do they take joy in their child? What does that look like for them? Also significant improvements in child well-being. So any behavior problems, externalizing, such as physical aggression toward others, internalizing, sadness, depression, that kind of thing. So the big thing is improvements in child safety. So there was, in these areas where they've done the fidelity reviews, there is a big improvement in physical care and the home conditions. Also psychological care. So children's emotional and mental health needs are getting met. There is more quality time that is spent with children. And also what I like in my world is fewer CPS reports. That's really helpful. Our reports have increased thanks to the schools. We know you all have to call us. They have gone up about 40 or 50 reports a month. So we're about 250 reports. And so if we can do a better job at working with families who have abused or neglected their children through this program, we're going to reduce the number of reports. My investigators aren't going to be as stressed out. Their caseloads will be lower, which also means they can spend more quality time, right, with the family. They're not running from one home to another or one school to another to interview a child. So lots of benefits as to why we chose family connections. And I know y'all probably can't see that, and I apologize. Hope you can see it in the, when you get the PowerPoint. So as part of our work in Family Connections, once we chose this evidence-based model, we had to come up with a logic model. And those of you who have done these are familiar with it. It was honestly the first time that I had done it from beginning to end, and it is so neat to see the process. So I'll just review a couple of things. So target families. So families reported to CYFD and assessed to have children that are safe but high risk, or safe with the plan, or families referred from community partners, which is you all here, in which there is a risk of future abuse or neglect. That's important, and I'll talk more about that. There's also criteria for family connection. There's a level 1 and level 2 criteria. The level 1 criteria is, which is kind of like, I guess, a no-brainer. There has to be a child under the age of 18 in the home to work with, because we are Child Protective Services. And there also has to be at least one parent who's available to participate in our program. There also does need to be at least one risk factor that may lead to maltreatment of that child. We have, as part of our structured decision-making tools, we have risk factors that we have to, it's a tool that we use. And so through our investigation, answering questions, gathering collateral information, of course, interview with the child and parent, we answer what's called a risk assessment. And a risk factor may be something like a parent has a prior history of substance use, like methamphetamine within the past 6 months. So that would increase the risk to a child. Although they might be clean right now, the risk of them relapsing could be high. So that would be an example of a risk factor. Domestic violence is also a risk factor. We know the research says that, and I'll just use a female, just for the purposes of this example, that a female is not beat up on by the perpetrator every day 24/7, right? We know that there's a cycle. We know that there's a coercive pattern of behavior. So if there's a history of domestic violence in that family, that definitely increases the risk of harm to that child. So that's another example of a risk factor. So the long-term outcome, the short and long-term outcome that we want to accomplish with Family Connections is that we want children to be safe. We don't want children to be harmed again. We also want them to have permanency, where they are in a home where there's a good relationship with their parent or their caregiver. And we also want their well-being needs to be met. Their psychological, physical, sexual, all of those well-being needs, we want those to be better. So this is just a fancy, this is something that we have to do as part of our Family Connections implementation. But I would encourage you guys, once you get this, I can pass this around, let's see. You want to just take a look at that. That we look back on, like, are we meeting the target? Are we missing something here? So this helps keeps us focused.
Marianne,
Yeah.
for the parent, one parent, at least one parent, can that be extended at grandparent, or is it specific to biological?
Yeah, it can be. What we assess is how long, like, is that the primary caregiver? Is there some type of guardianship in place? Or is it headed that way? Is this person like the stable caregiver? Yeah, sure. All right. So who are the families to be served by our new Family Connections model? Oh, and I don't think I said this, that we went live July 1, which was really exciting. So unfortunately, we haven't had a lot of referrals to Family Connections, and we're hoping that that's going to increase in the fall with school starting. So the families that will be working with Family Connections are those that are reported to CYFD and assessed to have children that are safe, but high risk, like some of those risk factors I talked about, or safe with the plan. And what safe with the plan is, we have our structured decision-making tool where we're responsible for assessing the immediate safety of a child. In some families that we work with, we identify a danger indicator. And basically what that is, it's something that places that child in imminent danger. So an example, let me see. Recently, we have a 2-month-old that has a spiral fracture, a broken arm that was twisted. And what the research tells us is 9 times out of 10 that's indicative of abuse, that somebody twisted this baby's arm. So this baby has a serious injury with no credible explanation. This baby is vulnerable. This baby relies on adults to protect him. That is something that we would mark as a danger indicator. Once we do that, then we next look at, can we safety plan with this family? Does the caregiver have the capacity, the mental capacity, the physical capacity? Do they have a willingness? And do they have a network? Is there someone who can come and check on that baby? Is there someone who can come into the home several times a day to check on that baby? So those are the things that we look at. Those are the decisions that my investigators, when they're out there in the field, talking with family members, need to assess. And they never make decisions by themselves. They consult with their supervisor. All right, so this is where you all come in. Families that are referred from community partners where there is risk of future abuse or neglect. So you may not know that a family may have an open CPS report. You just may know that, man, like, something's going on with this family. We have a case, actually, where FYI, our contract provider is working with a family where grandparents, as a good example, are raising their granddaughter, and she has some hygiene issues. I think she just may have started her menstrual cycle. She doesn't want to bathe. She loves to paint. She goes to school like head to toe with paint. She has an odor. So we didn't get that report, but that family is working with Family Connections. So the school, what they did is they called FYI and said, hey, can you help this family out? So any one of you all can call FYI. There's a, and then they can help you through the intake and referral form. Okay. So I think I already spoke about this, the level 1 and level 2 criteria. So this is just a high-level kind of overview of family, the model itself. So that's our target population. Family Connections is a voluntary program. And to be honest, what family wants to work with Child Protective Services? Nobody, right? And we know that. Our investigators and our Family Connections program specialists have to be really savvy, really have to work on engaging that family. And the focus is on the practitioner and the responsibility to do that. That's something new in this model, which is great. The length of the intervention, it can be up to 5 months, or it can be 5 months. We can have 2 90-day extensions for a total of 11 months. It's a long time, right? But what the research has also shown is 3 months, 4 months, a targeted, well-worked intervention is just as good or even better than an 11-month intervention. We get fatigued, right? After having to work with the program so long. Another big component of Family Connections is initial contact. That has to happen within 24 hours. So once the investigator and the in-home services staff the case, they call the family and say, hey, can I go out today? Or can I go out tomorrow and meet you? We want to strike while the iron's hot. We don't want to wait. The frequency of visits is 1 hour face-to-face time per week. Another key component is the supervision. There needs to be weekly group and individual clinical supervision, and that needs to be provided by a master level supervisor. It can be social worker or related field. So just real quickly, got like 4 minutes left. Thank you guys for your attention. So these are the different phases. What I really want to highlight is the comprehensive family assessment. What makes this an evidence-based model? You know, I was talking about the laptops earlier. So the practitioner takes the laptop out, and the parent participates in what's called a CASI. We have acronyms for everything. It's a computer-assisted self-interview. And they're screening tools. We talked about parenting attitudes, right? There's questions that are asked of that caregiver or parent that say, oh, you know, what do you think about your child? Give me an example. So they answer all these questions. We have a fancy system that tallies all of their answers, and then that helps us to create a case plan. And that's what makes it the evidence-based model also. We never had that before. It was very subjective. So we go and we show the family, hey, this is where you scored really well. And this is where I can help you in this area. So we develop a case plan that is specific to their needs. And then this change focus intervention, that is a very deliberate and intentional time. And that's why the supervision is very, very important. There's prep before the practitioner goes out. They go out and do their 1 hour of the change focus intervention. So let's say, for example, if it's parenting attitude where maybe or parental stress, that hour is focused on helping that parent to decrease their stress. And then we have the evaluation of change. That's also a very deliberate process. And then the case closure. Something that's really awesome the last few years with our safety organized practice and structured decision making is that we are going to be having, or we already have started, having ongoing coaching and mentoring from our Action for Child Protection folks. They are the ones who develop the Family Connections program. So we meet with them a couple of times a month. We run cases by them, run scenarios by them, and they help us. All right. I talked about that. Okay, so this is the last slide before the thank you slide. So these are some major steps. We executed a communication plan. We did a statewide blast to our internal CYFD employees as well as external. We completed trainer onboarding. In order to get certified in Family Connections, I spoke earlier about the e-learning modules. There's over 50 hours of training that has to be completed and a certification process. So we did 4 weeks of training with in those implementation sites and also with our contract providers. So because of funding, unfortunately, we weren't able to do a whole statewide implementation. That will happen in March of next year. So we'll be training the rest of the counties. So every county in New Mexico will be implementing Family Connections. Let's see. I think that's really the highlights. Any questions or comments? Yes?
How do you keep staff motivated? Because you know how they say it takes a village to raise a child.
Yeah.
And you're dealing with all these traumas within the family unit.
Yeah.
Do you do anything in particular to keep staff motivated? Because it's a lot of work.
It's a lot of work, yeah. So the question is, how do we keep staff motivated? For Family Connections, there's a lot of reflective supervision. There's definitely focus on self-care. And also those tiny little positive changes that we see. Just the whole emphasis of Family Connections is strength-based. So it's not focusing on what's going wrong, it's focusing on what's going right, and how can it help you with these other things. Yeah.
Just curious.
Yeah. And I'm very blessed right now. We have 7 practitioners here in Dona, which is the largest in the state. Unfortunately, we lost one, so that is being advertised. FYI.
So, when you say you have a practitioner and what do you call the other person that goes in and says?
The investigator?
So do you have like a wraparound team that helps make the decisions? How does that work?
For Family Connections, yes. It starts with the investigator having that conversation with their supervisor and or their family or the family first, saying, hey, there's a new program. It's really shown to help people. You know, we want to present it in a good light, right? And then the investigator and supervisor decide. Then they consult with the in-home services supervisor. Sometimes where there's cases that are a little sticky, I'll get pulled into those, and then we make a decision as a team. Yeah, a lot of consultation, a lot of staffing.
How quickly are those decisions made?
Very quickly, very quickly. We want the investigation to be near completion. So, I mean, we're not going to refer a family to Family Connections if they haven't interviewed the alleged victims or done a home visit, but once it's near completion, what's awesome about most of our investigators is that they're pretty seasoned. They have a good radar. Like, hey, like, this family's high risk, like there's something going on there. You know, I'm going to talk to them about, you know, home-based services, Family Connections. Yeah, so it happens really fast. Yeah. Roseanne's still